Go ahead.
Hello, everyone. My name is Lynn Maliserdinsky, and I'm the Quality Programs Manager for the American Heart Association. Today, I'm going to be talking to you about some resources the American Heart Association provides around the topic of heart failure. We have a lot of resources to offer, so I've broken these down into two categories: resources for professionals and resources for patients. To begin with, we will discuss some of our resources for professionals. The number one resource we provide are our evidence-based guidelines. A quality improvement tool demonstrated to improve adherence to evidence-based guidelines for patients hospitalized with heart failure is our Get with the Guidelines Heart Failure Program. This program provides hospitals with a web-based patient management tool, decision support, and real-time benchmarking capabilities, and opportunities for recognition to the evidence-based guidelines. We currently have 1,209 hospitals participating in Get with the Guidelines Heart Failure nationwide, and 25 of those hospitals are located in Wisconsin. Our Get with the Guidelines Heart Failure program consists of measure sets that hospitals can utilize to guide their practice according to our guidelines and monitor performance improvement. Our achievement measures are the highest level of evidence recommended for treatment of heart failure patients, followed by our quality measures. Both of these measure sets are listed here for your reference. On these next few slides, we will walk through some data on all hospitals' adherence to these measures versus Wisconsin hospitals' adherence to these measures for the year 2017. In this first graph, you can see that Wisconsin hospitals are performing almost the same or slightly better in the case of ACE, ARB, and ARNI for adherence to all achievement measures, with the exception of post-discharge appointment. We do have some room for improvement in working on that post-discharge appointment measure. On the quality measures, you can see that Wisconsin hospitals are adhering to these measures at a higher rate than the all-hospital group benchmark. However, we do still have significant room for improvement on measures such as aldosterone antagonist at discharge, hydralazine nitrate at discharge for African American patients, and CRTD placed or prescribed. Continuing to look at the quality measures, again, Wisconsin is performing better than the US benchmark group on all of these, but there is still room for improvement on ICE placement, influenza vaccine, pneumococcal vaccine, and follow-up within 7 days or less. In addition to our achievement and quality measures, hospitals have the ability to collect and run real-time reports on several other data elements that may be important to their current organizational goals and organizing process improvement for their overall heart failure program. For your reference, those additional measure sets are listed here, and I would like to specifically highlight our 30-day follow-up form. This form allows hospitals to track post-discharge data in order to really focus on the transition of care and prevent readmission. The 30-day follow-up form will also be a focus of a new project that I'm really excited to announce. This project is our Quality Improvement Platform Support Project. This initiative is funded as the result of an award proposal request submitted by the American Heart Association to Novartis. This will be a 2-year project that will drive national impact, including the building out and training on the 30-day follow-up form. It will also provide targeted intensive implementation activities in 3 specific markets nationally, with Milwaukee being one of those chosen markets. This will be available to all interested hospitals in Milwaukee, Racine, Washington, Waukesha, and Kenosha counties. In addition to a focus on the follow-up form, we will develop many other best practice sharing resources, including targeted education, podcasts, webinars, and assistance for Get with the Guidelines hospitals participating in the project. There will be much more information to come on this, but we're really excited at the resources that we will be able to share throughout this project. The first step to preventing readmissions is to ensure that we are providing high-quality, evidence-based care during the patient's first hospital visit. We previously discussed our Get with the Guidelines Heart Failure Quality Improvement Program. Another valuable guideline resource is our Heart Failure Guidelines Toolkit. This toolkit can be accessed through the link listed at the top of this slide. It is a free resource that provides an excellent overview of the heart failure guidelines. Some of my favorite items from the Heart Failure Guidelines Toolkit include a breakdown, bullet points of just the top 10 things to know from the guidelines, a guideline algorithm, and sections highlighting important comorbidities in heart failure. These sections offer additional downloads for items such as treating hypertension and sleep-disordered breathing. Another handy guideline tool is our Guidelines on the Go app. This free app allows you access to all of the American Heart Association guidelines on your mobile device. Another great resource for professionals is Target Heart Failure, or Target HF. Target HF is the American Heart Association's initiative that really focuses on the transitions of care for the heart failure patient and reducing 30-day readmissions. Through this initiative, we offer several great resources. The Target Heart Failure just underwent a major update, and information about Target Heart Failure itself and the overall initiative can be accessed at heart.org/targethf. You can also access a Target Heart Failure app, and that can be accessed through the link at the top of the slide. It's targethf.heart.org. This is a progressive web app, which means there is no need to download the app from an app store or have the app installed on your device. You can simply save the page to your home screen as an icon. You are able to view the documents from your phone, your tablet, your computer. You can access our list of existing measures through this app. There are links to a Gale risk calculator, a LACE Plus calculator. There is also key clinical topics and tools in the area of heart failure and webinars in our media area, and clinical tools that I'll show you a little bit more about in the next couple of slides that you are able to edit and email to yourself with the edited content. This is a screenshot of the Target Heart Failure web app home screen and the menu to provide you an overview of what this web app looks like and references some of the key areas I just mentioned. You are also able to access patient education tools and resources from this web app. You can locate materials that are related to cardiac rehab, medication adherence, and explanations of the condition of heart failure itself. Through the Target Heart Failure app, you are able to also access recordings of our national webinars featuring important topics on the management of heart failure. That is located under the media section of the app, and you can access things on transitions of care, webinars, clinical predictors of 30-day rehospitalization. There are a lot of great topics available under that media section to view previously recorded webinars. The Target Heart Failure app also offers access to readmission risk calculators, including the core risk calculator and the LACE Plus calculator. Both of these have been built into the tool so that you can enter your patient's characteristics and receive a readmission risk score calculation right away. In addition to the resources I've already mentioned that are available within the Target Heart Failure app, my favorite resources are the clinical tools available. These clinical tools are available to download and edit or to work from right within the app and then email to yourself. You can also modify these documents and embed them into your electronic health records if you prefer to work from them directly in the record itself. Some of these tools include checklists, such as the discharge criteria checklist. This checklist allows you to quickly look at the recommendations for all heart failure patients and ensure these elements of care are received prior to patient discharge. And then this is just another view of the discharge checklist itself. The next resource available within the Target Heart Failure app is a template for a follow-up phone call. We know that written instructions alone are often not sufficient to reduce hospital heart failure readmissions. A follow-up phone call can help to assess not only the patient's health status, but also whether the patient truly understands the education that they received in the hospital. They understand the cause of heart failure, their prognosis, the treatment they're receiving, any dietary restrictions, activity, the importance of self-care adherence, and signs and symptoms of worsening heart failure. Through a timely follow-up phone call, healthcare providers can determine if patients are adherent to their medication plan of care, and if not, why not. A follow-up phone call can also determine if additional follow-up consultation is needed and when. So this tool provides you an example of questions that you can ask during a follow-up phone call. And again, this can be modified to meet the needs of your organization. Another great tool available within Target Heart Failure is a readmission interview. If a patient is readmitted, this template provides a list of questions that can be asked of the patient and family to identify process change opportunities, barriers, and potential causes for readmission. Again, looking at readmission review, we also offer a readmission factor document that allows the identification of potential gaps in hospital, provider, patient support system, transitional and post-discharge care for heart failure patients that may contribute to potentially preventable readmissions. Through this tool, you can track data related to readmissions and identify trends to further improve the transition of care process. Moving on from the Target Heart Failure resources, we also offer the Rise Above Heart Failure Toolkit. This toolkit can be accessed at heart.org/riseabovehf. This is a great resource for nurses, care coordinators, social workers, case managers, really anyone that just might need a quick overall refresher on caring for a heart failure patient and the specific areas of importance to focus on for patients with that chronic condition. In the next few slides, I will just highlight some of my favorite pages from the Rise Above Heart Failure Toolkit, starting with the basics, including a great overview on recognizing the signs and symptoms of heart failure. And within this section, there are also links within the toolkit to resources such as a heart failure symptoms poster that you can use as a refresher for yourself or within your clinic so that patients are aware of what those symptoms to recognize are. Another one of my favorite sections in the Rise Above Heart Failure Toolkit is on the importance of patient education. The toolkit provides the person providing that education with the elements to reinforce and focus on when educating the patient. It also provides some fantastic checklists that indicate the areas of education to highlight. Other patient education areas to highlight within the Rise Above Heart Failure Toolkit include information on the importance of health literacy and on active listening and motivational interviewing. In addition to active listening and motivational interviewing, Teach Back can be a great method to utilize when educating our heart failure patients. Teach Back is a technique for healthcare providers to ensure that they have explained medical information clearly so that patients and their families understand what is communicated to them. Studies have shown that utilizing Teach Back can reduce readmission rates, and if the patient is readmitted, the second hospitalization length of stay is shorter. This document within the Rise Above Heart Failure Toolkit provides the teaching points and Teach Back questions and answers for the educator to utilize with their patient. I'll also quickly mention another great Teach Back resource that is not an AHA resource, but it is really wonderful. It's teachbacktraining.org. This is a site that includes an interactive learning module and coaching to always use Teach Back tools, such as an observation exercise that someone can observe another person demonstrating Teach Back and offer them feedback. It also offers coaching tips for supervisors and managers to encourage staff to always use Teach Back. So why is Teach Back important? According to our 2015 Heart Failure Awareness Survey, this was real data gathered from patients, definitely showed the need to continue providing education to our heart failure patients and families. I'll just pull out a few sections from this awareness survey to highlight a few key important items. You can see in this circled area here that despite the prevalence of heart failure, search activity for the term heart failure is lower than other common conditions such as high blood pressure, cancer, and diabetes. Nearly half of the respondents in this awareness survey said that heart failure is a silent killer with no symptoms. This demonstrates the need to continue educating our heart failure patients on the signs and symptoms of heart failure. So now we're going to discuss some of the resources that we have available for patients, starting with the resources we have to include education on really what they can do to recognize those signs and symptoms. And one of those is our self-check plan. This is a great resource to create into magnets, tearaway sheets, anything that you can think of that the patient will see on a daily basis to really get them aware of the signs and symptoms and when to seek help. We also offer a Partnering in Your Treatment document. This is a 2-page document that patients can utilize when seeing their provider, and it can really help guide their discussion and get their questions answered in order to help empower them to care for themselves when they go home. It includes questions such as, will I be taking medications for heart failure? what do I hope to accomplish with these medications, and what will be the results if I don't take this medication. It also highlights the signs and symptoms of heart failure again to really get that ingrained in their memory so they know those signs and symptoms to recognize and when to seek help. Another great resource that we have for patients, and again, these are all free resources, is our Patient Resource Center. This resource center provides some really great, easy to understand patient education materials on topics such as what is heart failure and your ejection fraction explained. Professionals can also access this resource center to obtain educational materials to provide to their patients. This is an overview of what the Resource Center home screen looks like and some of the additional available information to links that you can access through this Resource Center. In addition to the Patient Resource Center, we offer the Patient Support Network. Going back to that 2015 awareness survey, there were 3,000 search queries were completed on Google searching for heart failure support groups. The Patient Support Network is a great free online support resource for patients and their families. There are also resources for on the Patient Support Network website for hospitals or clinics that might want to implement in-person support groups. It provides things like sample agendas for a calendar year with sample topics and questions that you might ask when facilitating a support group. A free app that is also available to heart failure patients is our HF Path app. This app is an intuitive tool that enables heart failure patients to better control their condition by managing symptoms, tracking medications, and maintaining a healthier lifestyle. In addition to tracking weight, medications, and symptoms, the Heart Failure Path app also enables users to connect with other patients dealing with the challenges of heart failure. So it will connect them to that support network section of heart failure where they can connect with other caregivers and patients that are dealing with the challenges of heart failure. This is an actual app that can be downloaded from an app store. Lastly, a free interactive workbook that we have available to patients is the MyHF Guide. That is accessible at heart.org/myhfguide. This workbook covers topics such as understanding heart failure, treating heart failure, managing your symptoms, and more. It also offers a prescription pad so that if providers want to prescribe the MyHF Guide for use by their patients, they can do that as well. This here is just a list of an overview of some of the resources we discussed in today's presentation. So all of the links to any of the documents I referenced are all listed here on this one slide. I really hope that this presentation and the American Heart Association's extensive compilation of resources available around the topic of heart failure will be helpful to you in your journey of providing the highest quality of care to your patients. If you have any questions at all, feel free to contact me at my email address listed here. Thank you.